How's it going? So today we're going to talk about piriformis syndrome. This is a problem that people usually get with an asymmetrical hip shift. Is typically where it stems from, but it ends up being the muscular tendon in the piriformis in the gluteal region causes pain all the way down the leg. It can cause numbness, tingling, even sciatic type pains. Now I don't want you to get confused. Piriformis syndrome and sciatica are different things even though they're very similar. So today I'm going to be talking about piriformis syndrome. Now the first thing I want to show you is self-myofascial release. That's the first technique we use when we're dealing with anything of a restriction. So the restriction we're talking about is going to come right from here and into the hip. So I'm going to show you what tools you can use. I'm going to show you what stretches you can do, activation exercises such as strengthening, and 1 or 2 integrated exercises. That way you get your nerve and your muscle working together. So let's get to it. First thing I want to show you is the foam roller. Now this is a high density foam roller. This is something you can use to blanket the area. If you were a massage therapist, this would be similar to them using their palm or their forearm on an area. This one is the same thing, except it's got these divots in there, so at least you have a little variety. Now, if you want to get deeper into the muscle, you got your tennis ball, your racquetball, you can even use a golf ball or a lacrosse ball. I'm going to show you these as well, but I want to go through this one first. After you go through your foam rolling, you go through some static stretching. But static stretching alone won't sustainably keep up with what you need done. You need your hips to become more mobile. Without that extra mobility, it's likely to go back, or it's just less likely to stick. So we want to make sure we do both. After that is a strengthening exercise or 2 that's specific. In order for me to figure out if you had something of an asymmetrical hip shift that was contributory, I'd have to assess you myself, or you'd have to figure it out. So I won't go too much into that today, but I want you to see that with these things and with the rolling and the stretching and the strengthening, you should be able to fix some hip issues, whether it's piriformis related or not. So let's get to it. First one I'm going to show you is the foam rolling. So first thing I want to show you for piriformis syndrome is going to be the self-myofascial release technique using a high-density foam roller. I'm going to use the 36-inch one first. All you do is sit right on it. Show you the slight angle. Now, if it's on the right hip, that's the hip that you use. I want you to take your ankle, press it over your knee, balance yourself out, lean onto that hip, and then roll up and down just a little bit until you feel something. It's going to feel a little uncomfortable. That's the spot that you want. Now you can stay there as long as it's tolerable. If it feels like it's getting to the point where it's too intolerable, I want you to go ahead and back off or stop completely. Now that's with the foam roller. Take this out of the way. If that doesn't feel like enough, you have your other options. You have your tennis ball or your racquetball. So the way you find your piriformis is by feel. If you feel it out and it hurts in that spot, that's what you'd be going after. Starting off on the wall over here, what you can do is put this tennis ball, I'll show you on my left hip, right here on the wall. You can press into it from there and get a feel for that. Press in as much pressure as you feel like you need, but it shouldn't be so much that it's causing you agonizing pain. It shouldn't feel like it's intolerable. It should feel like you can do it for about 2 minutes. Now, if you've gotten off the wall and that feels, okay, that's not really hitting it for me, that's not doing enough, then we go down to the floor and we use all that body weight and all that gravity on that spot. So, after self-myofascial release, we go into stretching. That's what we want to do next. So, lay down on the ground. There's 3 different stretches I'm going to show you. 2 of them are going to be down here, and 1 of them is going to be using something called a road band. So I want you to lay down, flatten your back, bring this leg over. First we're going to push in this direction here, 5-second hold. Then we're going to pull in this direction here, 5-second hold. And repeat. You're trying to get more length each time you do this. Each time you do it, try to get a little bit more length, inch by inch. Now, that's the first one. Second one's going to be for the back of the leg. I want you to grab right here, lay down flat, point your toes up. Knee should be at 90 degrees. From there, straighten up your toe, kick your heel towards the ceiling. You should feel right back here. Hold that for about 5 seconds. Relax slowly. Try to get a little bit more length in your knee in this direction each time you do it. Pulling your toes down. Next one is a cross. So you're going to take your hand, your opposite hand, grab this rope right here. That's what it should feel like. Bring it slightly across your midline. Same thing, toes are pulled up towards your nose. Cross your body. Relax. If it gets too intense, I want you to work on your breathing. You're going to do that about 7 or 8 times. Now the last one is with the robe band. So the robe band, right here. This little device is really good for hip mobility. This is the robe band. This is going to help you stretch out your hip flexor. Now, we didn't get into self-myofascial release for the hip flexor. It's the same idea with the ball or the foam roller, but I'm going to show you this one anyway because I think it's super effective to help out the opposite side of you. So you wrap this around something, step your leg through, bring this band up to about the bottom of your butt cheek. Whichever leg it's on, that leg goes behind you. From there, what I want you to do is hip forwards, flexing this glute, heel down, and just hold it out for about 2 minutes. This is called a PA glide, or a posterior to anterior glide of the hip joint. It's going to help release a lot of that tension that comes with having a tight hip flexor. So once you're done with that, come out of this very slowly. Drop that down. Now let's go through some of the strengthening exercises. The first one is called the hip clam. The second one is a standing side raise for your leg. The last one is for integration. Now, when you integrate, all that means is you're developing a spine or a neuro to muscular connectivity between your muscle, your brain, your nerves. That way it's more likely to stick on a global scale. The stuff we're doing at first is isolation. So, on your side, the hip clam, you lay down, knees line up with midline, feet are together, take this knee, bring it up. That's all there is to it. The muscle we're going after here is known as the glute medius. That muscle is right here. So if you can't feel this, what you can do is add a band or some pressure right to that spot right there so you can feel what should be working. If that's too easy, straighten out your leg, bring it up. So after that, use a wall for balance. The standing portion of it is designed to help you balance. You point your toes up, bend that knee, keep it soft, belly button stays tight, bring that leg out. Now, I like going straight out and going back a little bit. That adds the glute medius, that adds your glute maximus a little bit more. There's 2 ones I want to show you for integration. One of them is a single leg deadlift. You stand with that foot right here, knee stays tracked over your toe, arms would be out, you kick that back leg forward just to about 90 degrees and back down. That works on balance. The last one is with the TheraBand or TheraTube. So, this is integration at its finest. Step with the band between the arches of your feet, cross these over to about your hips, hold right here, belly button stays tucked. Bend those knees and keep them soft, turn your toes in just a little bit, and then walk side to side. So walk this way, always coming back to hip width apart, and then walk back. When you're all said and done, come out nice and slow, stretch again if you need to, and that's how you take care of piriformis syndrome. Any questions, please let me know.